is Ray, psychiatric mental health nurse practitioner, where I promote mental wellness and awareness. So today we're going to be talking about attention deficit hyperactive disorder, which is in short ADHD. We're going to be talking about the treatment process and some of the therapies that can be used to help treat this behavior. In addition to the treatment process, we're also going to be hitting points in both adults and in children. But let's start off with the children first. Let's get to the video. Symptoms in children. So ADHD is a pattern of being unable to pay attention, being hyperactive, and impulsive, or both, that interferes with functioning and development. So some symptoms that is recognizable in ADHD in children: fidgeting with or tapping hands and feet or squirming in seat. Leaving seat when remaining seated is expected. Runs or climbs when it is inappropriate. Unable to participate in leisure activities quietly. Acts as if on the go or driven by a motor. Talks excessively. Blurts out answers before a question has been fully asked. Has difficulty waiting his or her turn. Interrupts or intrudes on others. Often forgetful. Avoids mental work or activities such as homework or classwork. Doesn't listen when spoken to. Disorganized. Loses things. Difficulty paying attention and easily distracted. These symptoms have an average age onset of 3 years old. Several symptoms were present prior to age 12. If 6 or more of these symptoms present, your child may need a ADHD screening or be evaluated by a psychiatrist, psych nurse practitioner, or a therapist. Some risk factors of ADHD is pregnancy complications, family conflicts, low birth weight, neglect or foster placement, alcohol exposure in utero. Some minor physically abnormal characteristics that are found with patients with ADHD are hypertelorism, or large distance between the eyes, highly arched palate, low set ears, and higher than average injury rate. In adults, ADHD often goes unnoticed in the ages of 18 through 44 years of age. There are no lab tests to diagnose ADHD, but providers may evaluate a person's medical and developmental history to look into their behaviors and how they interact with those around them. Some signs and symptoms of ADHD in adults: poor time management, poor focus, trouble multitasking, restlessness, poor planning, depression, poor self-esteem, irritable mood, and difficulty sustaining a healthy relationship with others. Some types of therapies that can be used for patients with ADHD is behavioral therapy, patient and parent cognitive behavioral training programs, psychoeducation, treatment of learning disorders, in family therapy and education. Some non-stimulant based medications that are used for ADHD are Strattera, Intuniv, Clonidine, Wellbutrin SR or XL. Some stimulant-based medications that are used for ADHD is Ritalin, Concerta, Adderall, Focalin, Vyvanse. Note that stimulant-based medications for ADHD can carry a risk of abuse. If prescribed a stimulant-based ADHD medication, you must monitor for GI upset or stomach upset, cramps, also anorexia, weight loss, blood pressure changes, increased heart rate, headache and dizziness, agitation or being irritable, in some rare cases, psychosis and growth suppression. I hope the content today was helpful in helping you understand the signs and symptoms and treatment process of ADHD. If you like the content, like, comment, and don't forget to hit that notification bell and subscribe at Mr. Ray Psych MP.